Welcome back. Today we're going to talk about gynecomastia. What is gynecomastia? Gynecomastia really is just excessive growth of male breast tissue. Some men have it. Could be genetic. It could be due to medications. There are various factors that can cause this, and it can cause quite a lot of distress to a lot of men who work out very hard but still have fullness in their chest or breast. And really, the only solution to that, aside from if there's a medical cause to it, is surgery, and this is gynecomastia reduction surgery. Who is a good candidate?
So somebody who is a good candidate for surgery has already stopped whatever is causing it. Sometimes it is genetic, but then sometimes it is caused by some of the supplements. It's caused by marijuana. If there are any hormonal disturbances, that needs to be addressed first. Sometimes it can be also caused by testicular masses or other tumors. So all of that needs to be figured out first before we pursue surgery.
What kind of surgeries can be performed depending on the extent of gynecomastia? So it can come in all shapes and sizes. It can be as small as just a little bit of breast tissue. In that case, we make a small incision at the bottom of the areola junction with the skin, and we actually just remove that breast tissue. It's a pretty quick surgery. The scar hides very well in that periareolar junction. Sometimes for larger excisions, we have to make the incision a little bit larger. And then there's often times where we have to do liposuction around the chest as well in order to get a nice flat tapered contour to give you a nice looking chest. Sometimes with patients who have massive weight loss, there's a lot of extra skin. That surgery is a little bit more involved, where we basically have to make larger incisions to remove the extra skin. That is very rare, but sometimes for certain patients it needs to be done in order to give them the best results. You don't want to have hanging skin. If we removed all the extra tissue underneath, it would just look like a saggy bag. So, but those patients are pretty rare, but sometimes they do involve larger incisions.
The recovery is different depending on the type of surgery. The most common surgery that we do is removal of a little bit of the breast tissue underneath the areola and liposuction around it. So the key to recovery is a lot of patience. Right after the surgery, you'll be placed in a compression vest, and you'll be wearing that vest for about 6 weeks. That's going to help prevent excess fluid from building up. It's also going to help prevent excessive swelling. After the 6 weeks, then you can wear the compression garment as you want. But things to note are that you'll see reduction of the breast tissue immediately. However, full results, you won't see those until about 6 to 9 months. So the key is patience here.
Yeah, the swelling could take a long time to go down, but that's basically it. It's a relatively quick outpatient procedure, even from a small one to a larger one. Maximum takes a couple hours. You're out and go home the same day. Recovery is pretty easy, and pain is pretty minimal. So if you're interested, give us a call. Thank you.
Thank you.